A case of hypovitaminosis, meaning there is decreased vitamin levels in the body. Couples who are on vitamin D and vitamin B12 supplementation, can they plan for conception during medication? Is there any untoward effect on the progeny? I would also extend, I like to extend the question are there any supplements which the patients, the couple are taking, when they are trying for conception, which should be cautioned?
See, in the case of hypovitaminosis, definitely as such, if any vitamin is coming in the way of conception, then definitely if it is in a hypo, then definitely the conception will not take place. But the general vitamin D and vitamin B12 and these things won't come in the way of conception. So if it is below, then there will be complication in the pregnancy and later in the delivery. So it needs to be addressed in the early part of it. That's the reason vitamin D or B12 or something like that, it is already been evaluated. Once it is evaluated and it found it as a hypovitaminosis, there is a reduction or there is a low, then you can take the medicines, supplements, which can fill this vitamin D and vitamin B12 deficiency. But there is nowhere, there is a word of caution or something like that while taking these medication, pregnancy should not be planned or pregnancy should not occur, or it has a very bad effect on the pregnancy. It's not like that. Nowhere it is vitamin D or vitamin B12 won't cause you any problem. Only thing is that if you take too much of them, then there is a problem. So it should be in that limit. Then there will be there will be no problem.
If someone is taking like iron, zinc, etc., there is any deficiency and if they are being treated, that should not be a cause for the problem, cause of concern, sir?
Definitely, see, when there is a hemoglobin, low hemoglobin, usually the supplementation is given with the form of folic acids, vitamins, and sometimes even in iron, and sometimes even with the zinc. So that if it is in a deficient state, then definitely it needs to be taken. When you are taking it, they're not going to harm you anyway. They won't come in the way of pregnancy, pathogenesis. But only thing is, the problem is, if they are continuously taken without monitoring, then there is a chances of problem. That instead of hypovitaminosis, then there may be hyper. Recently, one of my patient has seen, of course, a male, he was having vitamin B12 deficiencies, so he has been given vitamin B complex as a regular thing to consume. He consumed continuously, and last week when he checked it, it was more than 2000 kg per ml, something like that. It is more than 2000. The normal value is somewhere around 900, 930, something like that. So it is about 2000. So this happens. So we need to check on either side whether it is a hypo or hyper. That needs to be controlled. If there is any deficiency of that part, that needs to be fulfilled. But these vitamin D and vitamin B12 or these things won't come in the way of conception or they go cause any direct influence on the fetus. Nothing in the as such kind of.